Sleep is an important factor in brain health and keeping yourself sharp mentally. But studies show 10 to 30% of adults have trouble with sleep. The numbers are even higher amongst veterans, with some estimates reaching as high as 55%. Difficulties with sleep can show up in several ways. 1. Trouble falling asleep. 2. Trouble staying asleep. And 3. Awakening long before you plan to. The most common causes of poor sleep are nightmares, depression, anxiety, and excessive worry or pain. Using alcohol often leads to falling asleep easily, but often results in trouble staying asleep. Sleep interruption can also be caused by obstructive sleep apnea. This condition stops breathing for short periods during sleep, resulting in gasping or excessive snoring. Getting restful sleep is especially important to help you recover during all stages of a concussion. Restful sleep involves cycling through all 3 sleep stages, including deep sleep. Most people should aim for a minimum of 7 hours of uninterrupted sleep on a regular basis. Assessing your daytime sleepiness is one of the best ways to determine whether you may have a sleep problem. Think, over the last month, did you have a moderate to high chance of dozing off or falling asleep in the following situations? Sitting and reading, watching TV, sitting inactive in a public place, a theater, or a meeting, as a passenger in a car for long distances, lying down to rest in the afternoon when circumstances permit, sitting and talking to someone, sitting quietly after lunch, in a car while stopped for a few minutes in the traffic. If you answered yes to 5 or more of these situations, then you should consider talking with a doctor who can diagnose your sleep problem. They may discuss your sleep habits and see if medication could be a good short-term help. They may also recommend seeing a sleep specialist who can perform a sleep study to pin down what the exact problem is and develop a treatment plan that is right for you. Proper daytime habits are a great way to get good sleep. These habits are often referred to as good sleep hygiene and include going to bed and waking up at the same time 7 days a week, getting exposure to natural light every morning, avoiding stimulants such as caffeine, nicotine, and energy drinks after 2 o'clock in the afternoon, avoiding long naps, more than 30 minutes in general, avoiding any napping within 7 hours of your usual bedtime, exercising regularly, preferably finishing 2 hours before bedtime, avoiding alcohol within 2 hours of bedtime, eliminating screen time, phone, laptop, TV, 2 hours before bed. Read a book or magazine instead. Promoting a sleep-friendly environment, making sure to minimize noise and light and maintaining a cool but comfortable room temperature. To avoid trouble falling asleep, the following additional strategies may help. Trying a warm shower immediately prior to bedtime. Avoiding going to bed when experiencing strong emotions, such as anxiety, anger, or fear. Trying a white noise generator, or using a phone app for calming sounds. Learning and using meditation techniques, mindfulness, or progressive muscle relaxation to calm your mind. If you are unable to fall asleep after 30 minutes, get out of bed and read or listen to restful music. When you start to feel sleepy, return to bed. If you cannot fall asleep in another 30 minutes, repeat the process. Remember that good sleep is important to overall health and especially good brain health. Don't put off developing good habits. Thank you for watching. For more information on positive sleep habits, please visit the links below.